Is it on here? I'm freezing. Welcome back to the channel, and today I'm going to tell you everything you need to know about fevers. A fever means having a temperature of 38 degrees Celsius or above. And when we refer to having a fever, what we mean is that you either feel very cold or very hot, or sometimes you switch between the two. Sometimes a fever can also cause you to sweat when you feel very hot, or shake uncontrollably when you feel cold, which is called rigors. Fevers are not caused directly by an infection itself, but rather the immune system trying to rid the body of the infection. People tend to worry about getting a fever or how high the fever is, but in truth, the level of the fever doesn't tell us how unwell you are. So just because you have a fever of 39 degrees doesn't necessarily mean that you're more unwell compared to if you had a fever of 38 degrees. From a doctor's perspective, we're more concerned about the cause of the fever rather than the fever itself. And if, for example, you have a cough, a sore throat and a runny nose along with the fever, you likely have a viral upper respiratory tract infection, which may be commonly referred to as a cold. And usually for viral infections such as this, the fever tends to last a few days, though the other symptoms such as a cough or sore throat or runny nose may persist for longer, typically up to a week or sometimes up to 2 weeks. And remember, a fever is not necessarily a bad thing. It's a sign that you are unwell and your body is mounting an immune response to fight off the infection, whether the infection is caused by a virus, a bacteria, or something else. But if you do have a fever, you don't automatically need to take medication to lower it. However, the effect of the fever on the body means that you'll often feel terrible and achy, and for that reason, people do often take medication. And the medications that tend to help to reduce fevers are called antipyretics, and the two most common ones are paracetamol and ibuprofen. And remember to always read the label before using these medications to check that they are safe for you to take, especially as they should be avoided in certain medical conditions. And it's also important that you don't exceed the dosage of these medications, as they can cause side effects. So for adults, paracetamol can be taken up to 4 times per day, and ibuprofen can be taken up to 3 times per day. However, again, if you've been advised not to take either of these before, then you should avoid them. If you are feverish, we do tend to recommend drinking plenty of fluids, because if you're hot and sweaty, you'll lose a lot of the body's water, and you could become dehydrated. So we recommend increasing the amount of fluids you usually drink to counteract this. I would also recommend every household to have a thermometer to check for a fever, because sometimes you may have a fever without any of the obvious symptoms, and it's an objective way of measuring your temperature, and that's useful for us. I'll also put a link to a thermometer that I use in the description below in case you want to buy one. So when should you worry about a fever? Firstly, if you have a fever that does not come down at all, despite taking either paracetamol or ibuprofen, you should speak to a doctor. Now again, this is not necessarily a bad thing, but it is worth speaking to a doctor in case an examination or further assessment is required. Some people also worry about the fact that the temperature comes down with paracetamol, but then jumps back up again. But this is actually part of the normal immune response as the effect of the medication wears off, so that's not a bad thing as such. Also, if you are on immunosuppressant treatment such as chemotherapy, any fever needs urgent review by a doctor. And this is because you may need treatment because your immune system may not be able to fight the infection adequately. All the information in this video is intended for adults and not children, because there is more specific advice that differs from adults, and I'll make a separate video on that in future, and I'll put a link to that in the description below and also up here somewhere. I hope you found this video useful, and feel free to share it with others if you did. Before you go, make sure you do hit the like and subscribe buttons below to see more videos like this. You might also be interested in seeing this video that I made on coughs and COVID, which you can view here. And you might also like to know more about irritable bowel syndrome in a video that I made over here. And I guess I'll see you next time. So see ya.